Hey, how you doing today? What can I do for you?
I'm doing good. My name's Michael. I'm a first year nursing student, and I was hoping to shadow you today while you were doing some of your work.
Sure.
And I was hoping to get an SBAR on the patient you're going in to see.
Sure, no problem. Patient's name is Shanae O'Connor. She's in room 231. She's a 34-year-old female, African American. She's got allergies to Bactrim, and she is a full code. So, the reason she came in today, patient has a fever unspecified of undetermined origin, and she's got a secondary diagnosis of end-stage renal disease. So the patient has diabetes mellitus type 1 and the end-stage renal disease that we discussed. She presented to the emergency department today at 5:30 with fevers, chills, and general malaise. So the patient reports an elevated blood glucose and decreased appetite for the past few days. She does have minimal urine output for the last month. Patient has a history of renal failure secondary to the diabetic neuropathy and hypersensitivity or hypersensitive nephrosclerosis. So she's been undergoing hemodialysis 3 times a week for the last year. She is listed for a transplant 6 months ago. So her family history, she is married. She has an 8-year-old son. Both of her parents are still alive. Previous illness, she did about 3 months ago have a graft infection. It was resolved after IV antibiotics. She does have history of UTIs. She is on a renal diet of 1,500 mLs daily with fluid restriction. So, kind of review of her systems real quick. So the integument reports that AV graft we discussed with no tendinous drainage or recent color change. All other skin is intact. Denies any kind of vision changes or hearing changes. No nasal draining or anything like that. No sore throat. For cardio, denies any chest pain or palpitations. Denies for respiratory, denies any shortness of breath, and she did quit smoking 2 years ago, so she did want me to notate that. For gastro, she's actually had some weight gain of 10 pounds over the last few weeks. There's been no abdomen pain or bowel problems. She did report recently though with the appetite being down, and intake went down with the appetite. She did state that she has a decreased frequency of urination and volume, so the recent urine output has been concentrated and dark, but she denies any burning pain or difficulty. For musculoskeletal, she denies any kind of muscle or joint pain. For neurology, she does report some numbness and tingling in the legs. That kind of goes in with that diabetic neuropathy. For endo, diabetic mellitus type 1, since she was 8 years old, she has had an increase in glucose. The insulin's not working as well, she states. So they did do a chest x-ray. It was normal. We're waiting on the urine and urine culture, urinalysis and urine culture, and blood cultures. Those are all pending. So the plan is she is going to get dialysis and the IV ampicillin immediately after. Vitals were taken at 7:30. So temperature was 101.1, heart rate 95, respiratory rate 20. Blood pressure is 138/78, and pulse ox was 96%. She'd have pain level 4, and then she does have an IV in the peripheral right median vein, 18 gauge, and last blood glucose was 155. So, any questions?
No, that's a lot of information. Why specifically is the client receiving this medication you're about to give?
She's receiving the antibiotic for that unspecified fever right now. We're waiting on the cultures.
Okay. And the action of the medication, what is that?
Well, the antibiotic, it inhibits the third and final stage of the bacterial cell wall synthesis.
When should you question administering this medication?
If the patient is hypersensitive, an AV block, she goes into shock, use it with precaution with renal failure patients. They only receive this when the hemodialysis is instituted within 48 hours. So with just patient, and then that's what's going on. They're having hemodialysis. So.
Is there a therapeutic serum level of this medication?
Not therapeutic serum level. However, you're going to keep an eye on certain labs. So you're going to keep an eye on their CBCs, liver function tests, and their creatinine bun.
Okay. Which vital signs are you going to monitor?
We're going to monitor all the vital signs, but we're going to keep a specific eye on her temperature and her heart rate.
Are there any physiological parameters that you should monitor?
We're going to check, her pain, malaise, diaphoresis, and chills. Signs and symptoms of anaphylaxis, rash and pruritus.
What about interventions that we need to teach the client while they're in the hospital?
All right, so when they're in the hospital, always going to make sure call buttons within reach for them. Any discomfort at the IV site and any kind of signs or symptoms of any adverse reactions.
What about when they're taking it at home? Are there interventions for home?
Well, they need to call the doctor if she's having fever or diarrhea, especially if the stool contains any blood or pus. Um, don't treat the diarrhea, however. They need to make sure that they contact their doctor. And then this can actually even happen a couple weeks after the med's complete.
Okay. What are any of the side effects or potential adverse reactions?
So side effects: seizures, dizziness, nausea, vomiting, diarrhea, and rash.
Okay. And how are we going to know it's effective?
Well, once their temperature returns to normal, blood cultures come back and they're negative for infection, and when that white blood cell count is within normal limits.
All right. Thanks a lot, man. That's a lot of information.
Okay, no problem. All right, so let's go in and we're gonna give her IV. So. This up. Hello, good morning. Hey, Sinead, good morning. How you doing?
Oh, I'm doing fine. I was just in the restroom. I'm just getting back in bed.
Okay, no problem. Just set my card up. All right, so sheet for you. Good. Can you do me a favor and tell me your name and your age?
Oh, my name is Shanann O'Connor, and I was born in 1982.
Okay. No problem. So we have some antibiotics we're going to give you today for that fever that you've been having. Have any questions about it or any concerns?
No, it was ordered by a doctor. I need it.
It is. All right. So you always have the right if you don't want to take the medication, but you're right. It was ordered by the doctor, and they said that you need it. So let me go ahead and do me a favor. Let me go ahead and scan your wristbands. Good. Excellent. And pull out your medications real quick. All right. Medicine, it's clear. Expiration date. All right, good. Need some more. It's clear. All right. Excellent. So we're gonna get your IV started. Let me just get this out of the way. All right. So how are you feeling today? Having any pain or discomfort?
I'm doing all right.
Okay. Excellent. Just getting your IV lines here ready to go for you. Do you have any allergies or anything to any medications? I know we had the Bactrim there, but do you have any other allergies to
I
medicines?
think it's just that Bactrim.
Okay. Excellent. Alright. Get all the air out of that. Just gonna clean the IV site. Actually, I'm going to flush this real quick too, before we completely hook up the IV. Okay. Flushed. Excellent. I'm just gonna put that down there. Let me scan your band again. Good. Maybe we'll get that in a second.
Technology sometimes.
Yep.
Sometimes, you know, the cursor's gotta be in the right spot. Alrighty. Let's get this turned on. Just getting antibiotic hooked up now. Okay, excellent.
some medication started here, okay? Almost done. Doing okay?
Oh yeah.
Two, three.
I think I feel better already.
Yeah. It'll take a little bit longer than that, but
Oh, man.
4, 5. Hang on to it. There we go. Okay, excellent. So got everything running. Any questions, problems, any concerns?
No, thank you
No?
for your work.
Okay, make sure we got your call light next to you. Okay, excellent. So we'll be back in a little bit to check on you after that finishes up. Let me just document some stuff real quick. Document the medicine. Okay. Alright, I'm all set with you. Alright, we'll be back in a little bit to check on you. Like I said, just give me a call if you need anything,
All
okay?
right, thank you.
You're welcome.
Go to the bathroom.
Yeah, I'm gonna go out. Alright, excellent. Alright, so you saw everything. Do you have any questions for me?
Yeah, were there any pertinent pieces of information you reviewed before administering the medication?
So, there were. We're gonna review, for, let me see here. Review the patient's rights, make sure, their allergies, any history of illness, medication, contraindications. This is why we were checking on her end-stage renal disease. We're making sure that it was appropriate to give medicine.
Did that information affect your decision to administer the medication?
It did. Her status with the end-stage renal disease, it needs to be used, the medicine's used cautiously. The medication indicated that you could get blood cultures. You give it to get the blood culture results back, and administering the first dose would be okay.
Did the information affect how you administered it?
It did. Just, you're going to check the 5 rights. They always have the right to refuse it. But, right dose, right time, right patient, medicine, and route. So, and it was how, it was ordered IV by the doctor, so it was correct.
All right.
All right.
All right, thanks a lot.
You're welcome.